A 64-year-old Caucasian male loses consciousness near the entrance to an emergency room. A physician rushes to the patient and palpates a strong pulse along the inner side of the sternocleidomastoid muscle. The question is, the vessel palpated by the doctor is a derivative of which of the following aortic arches? The choices are A, first, B, second, C, third, D, fourth, E, sixth. If you know the answer, click the like button. If you're an average person, keep watching. The correct choice is C, which is third. During embryonic development, the head, neck, and upper thorax region develop from a set of arches known as pharyngeal arches. Each arch is associated with a cranial nerve and an aortic arch. The first pharyngeal arch is associated with the first aortic arch and the trigeminal nerve. The first aortic arch regresses almost completely. It does give rise to a portion of the maxillary artery. The second pharyngeal arch is associated with the second aortic arch and the facial nerve. This pharyngeal arch gives rise to the muscles of facial expression as well as some ear and hyoid-associated structures, but the associated second aortic arch again does not make a contribution to adult structures in humans. The stapedial artery is a derivative of the second aortic arch, but this vessel typically regresses in humans. The third pharyngeal arch is associated with the third aortic arch and the glossopharyngeal nerve. This pharyngeal arch gives rise to parts of the hyoid bone as well as the stylopharyngeus muscle, and the third aortic arch forms the common and proximal internal carotid arteries. The common carotid artery is the one palpated by the physician mentioned in the question stem. The fourth pharyngeal arch is associated with the fourth aortic arch and the superior laryngeal branch of the vagus nerve. This pharyngeal arch gives rise to many of the muscles of the pharynx and soft palate as well as a few of the laryngeal muscles. The fourth aortic arch gives rise to part of the true aortic arch and subclavian arteries. The fifth pharyngeal and aortic arches are obliterated during fetal development. The sixth pharyngeal arch is associated with the sixth aortic arch and the recurrent laryngeal branches of the vagus nerve. This pharyngeal arch gives rise to most of the muscles of the larynx, and the associated aortic arch gives rise to the pulmonary arteries and the ductus arteriosus.